The system of out-of-home care is incredibly complex, from traditional foster care to residential treatment facilities. The variety of options depend upon the needs of the child. One of the primary challenges is finding the right service for the child so that they can grow optimally in their environment, both physically and emotionally.
Children in both the child welfare and juvenile justice system are often placed in the custody of the state in order to keep them safe. In Nebraska, about 70% of these kids, who we call state wards, are in out-of-home care, which means that they're not placed with their families, but they're living somewhere else. So out-of-home care can range from a child living in a foster home to a child being placed in detention or prison if they're a youth with a law violation. In other cases, if a child can't find a home, they can live in a temporary shelter, or if they have severe behavioral health needs, they can live in a residential treatment facility. One of the problems with out-of-home care is instability in a child's life. Every year in Nebraska, for the past 10 years or so, we've seen between 9,000 and 12,000 children come into out-of-home care at some time in the year, which means they've lived apart from their families and been wards of the state. There are no fixed numbers or percentages that we should be aiming for in terms of children in out-of-home care, but we do know that children have emotional needs that out-of-home care doesn't always do the best job of fulfilling. And so really, the ideal would be to have as few children in out-of-home care as possible, while still using out-of-home care for those exceptional cases where there's no other way to keep a child safe.